Leslie Zigler. I'm coming to you live from the Digital Health Summer Summit here at UCSF, and I am sitting here right now with Julio Corredor, who is working with Pfizer on some really interesting global work. Can you tell us a little bit about, both what brings you here and your role within the company?
Yeah, absolutely. So in this summit, we are here to talk a little bit about our work with AARP, with the Catalyst program. And I am from Pfizer, and my role within Pfizer is in the worldwide innovation team. And essentially, what the team is about is both creating a fertile ground for people within Pfizer to feel like they can innovate, bring their ideas forward, and experiment around them. And this is beyond our traditional area of innovation, which is the molecular entity, but really encouraging people throughout the organization to feel like they can really innovate around all aspects of the organization. The other aspect that we work on is more external facing, and it's helping identify some of the solutions and partnerships that can help us address some of our challenges. So that's why the engagement with AARP around the Catalyst project is important to us, because it can help us really understand the power and the efficacy of some of the solutions that are relevant to the 50+ population.
And it's interesting, your background also, or your part of your function is also to work at kind of this global level, which I think is really interesting and something that certainly stands out in the context of the summit. So can you talk a little bit about that too?
Yeah, definitely. So innovation increasingly, and particularly the entrepreneurial phenomenon, is a global phenomenon. So increasingly we want to make sure that we tap into the solutions that are not only being created here in the US, but also around the world. So we've started to build some of the relationships in some of the key countries where entrepreneurs are really flourishing, like in Israel, like in Germany, like in the UK, where we know that we can find some of these solutions, and there are some partners that are starting to establish their networks there so that we can work together to not only find solutions here in the US, but around the world.
Great. So if there's one thing that happened up on stage that you feel like people may have missed, what was kind of one crystal moment that you would like to share with the intertubes world out there?
Sure. Well, I'll just mention one thing that I commented on before, which is that for us it's not just about the looking at the customers and the patients from taking a drug. It's really kind of the more overarching way that they engage with their disease and the challenges and opportunities that are around treating a disease, starting from finding and identifying the disease to presenting to a doctor, to then getting access to that product, to then understanding efficacy of that product. So it's really important for us to look at that spectrum and find solutions that really cover different aspects of that engagement of a patient with a disease.
Fantastic. So if you had a pro tip for people who would like to work with any of your programs, how would you suggest they approach that?
Yeah, I would say I would ground it into really cases and case studies and use cases where there is a knowledge around what is the importance that it can have to an actual disease or an actual condition, or the way that an individual engages with their disease. So as the more that they can prove that it can benefit a particular pool of patients or a particular phase of a disease state, the more valuable it will be for us, because then we can really understand where can it play a role in our engagement with the patients and with the different stakeholders in the ecosystem.
Fantastic. So where can people find you on the internet? LinkedIn, Twitter, all that?
They can find me on LinkedIn, they can find me on Twitter and on Instagram.
Oh, what's your Instagram handle?
It's Julio Corredor.
Awesome. Well, that's where we'll be looking for you, Julio. Thank you so much for being here today.
Thank you for having me. It's great talking to you.
Great.